So whenever you think about a new pharmaceutical agent, we always ask ourselves three questions. One, what's its mechanism of action? Two, what does it perform like clinically? And three, what are the adverse effects? So when we think about the mechanism of action, we think about a few things. One is, what's the active ingredient and what's its mechanism of action, but also how is it delivered to the ocular surface? So when you're thinking about Qlosi, think about a low-dose pilocarpine that's 0.4%. And what that is a direct-acting muscarinic agonist. What that means is it acts on the sphincter muscle, and it reduces the size of the pupil. And in doing so, it actually extends a patient's depth of focus. Again, we know that we're very comfortable with that concept in eye care. Where the beauty comes into play is that you could leverage a lower dose of pilocarpine because it's packaged in a more neutral solution. And because it's packaged in a more neutral solution, it increases the bioavailability of pilocarpine, allowing it to get into the ocular tissues more effectively. Now, the icing on the cake with all of this, it's actually packaged in sodium hyaluronate and hydroxypropylmethylcellulose. So when you put all of that together, you really have a winning combination in a way to deliver low-dose pilocarpine to the ocular surface in a very, very effective way. So when we look at the adverse effects, we're asking ourselves, when we apply a pharmaceutical agent to the ocular surface, are there going to be anything that we should expect to see, and at what rates are those? And typically, when I'm thinking about utilizing a drop in my mind, anything less than 10% gives me a high level of assurance when I'm prescribing it to patients. And that's really what we have here. The first question we ask ourselves, because it is pilocarpine, even though it's low-dose pilocarpine, we ask ourselves, is there any incidence or propensity towards headaches? And there is. About 6.8% of patients in the clinical trials experience headaches. The good news is that most of those patients, about an hour after drop installation, if they did experience it, had the absence of it after that. The second thing we ask ourselves is, well, how comfortable is the drop? And the good news is the way that it is engineered with the pH, with the sodium hyaluronate, and with the HPMC, we realize that it's a comfortable vehicle that it's packaged in, and that's reflected in the adverse events. There was about 5.8% of patients that experienced some level of site installation irritation, but again, most of that was very, very short-lived with individuals. I think part of the brilliance behind the technology is the EyeQ formulation. You may be asking yourself, what's the EyeQ formulation? Well, it's a combination of four things. Low-dose pilocarpine, which is remarkably effective because of the neutral pH that it's packaged in, which is the second component of the EyeQ formulation. The third component is the lubricating agents that actually make it comfortable when you place it on the eye. And the fourth piece to this whole puzzle is that it's preservative-free. So there's very little ocular surface concerns when we're placing this on the eye. So a lot of times when we see new pharmaceutical agents come to market and we're thinking, who is that best candidate? I always start to take a rundown of what a patient's priorities are. So when we're thinking about that ideal candidate, is the patient presbyopic or not? Because obviously, if they're not presbyopic, they're not a candidate. And then if they are presbyopic, how are they currently correcting their presbyopia? And how satisfied with those options are they? And is there an opportunity to provide them an alternative to what they're currently utilizing? I'll give you a perfect example of an individual who may not necessarily be a great candidate. Somebody who's happy with their progressive edition lenses and who wears them all the time and just enjoys them. I'll give you an example of somebody who may be an appropriate candidate. Somebody who wears progressive edition lenses but doesn't want a second pair of glasses to actually put on when they're working at the computer screen. And we all know the limitations that a progressive has at a computer screen. You have to tip your head back to get through the near zone. So with Qlosi, it actually gives them the ability to help them see up close better through their distance correction in the top. So that's one of the options. Certainly those patients that are or that don't need any type of correction, that are just simply presbyopic, those individuals are individuals that are seemingly great candidates for this technology, especially if they're interested in alternatives to their current reading glasses. And the one that I don't think we should forget about are those contact lens wearers that maybe tried multifocal contact lenses, maybe tried monovision, but weren't as successful as they wanted to be. And now are utilizing reading glasses over top of their contact lenses, or simply stopped wearing contact lenses. One drop prior to lens installation, waiting an appropriate time period until lenses are placed in the eyes, now will give that patient the ability to see up close again. So when we're thinking about a clinical pearl or a way to optimize outcomes here, just like everything new, patients kind of have to understand how to utilize the technology. And what seems to work best is for those patients that are starting Qlosi to actually utilize the drop twice a day for the first week. The reason why that is their eyes are experiencing something different, something new, for the exact same way that a first-time progressive edition lens wearer will have a little bit of an adjustment. The first-time multifocal contact lens wearer will have some level of adjustment. Qlosi is no different than that. So give that patient the opportunity of getting the full learning curve out of it by making sure that they're utilizing it twice a day, separated by 2 to 3 hours, and that will increase your chances of having the best outcomes with those patients. So a few things that I want you to keep in mind as you're thinking about Qlosi as an option. First and foremost, it works great as a standalone option for patients because, again, pupil modulation and reducing pupil size very clearly extends depth of focus and gives our presbyopic patients more functionality as a standalone option or leveraging it with other technologies. In addition to that, keep in mind that even though we're working with a low dose of pilocarpine, 0.4%, it's remarkably effective because of the neutral pH that they packaged it in, along with the lubricating agents that they've utilized to deliver it to the ocular surface. And again, the icing on the cake with this is that it has a low adverse events profile. So those are really the three things that you should keep in mind with this technology. So sometimes when we think about what creates success versus failure in eye care, we think somebody needs to be utilizing everything all the time in order for it to be successful. That's not the case with Qlosi. Some patients may decide to use it every day. Other people just may want it for when they want those Qlosi moments. Going out in the evening without having to need their reading glasses. Having a day at the office where they want more functionality without the need for some type of other medical device to help them. And that's what I think the beauty is about this, is the flexible dosing schedule that we provide our patients with a pharmaceutical agent, providing them with those Qlosi moments.